because 50% of people with high blood pressure will not know that they have high blood pressure. It is asymptomatic. The brain is just preparing you to overcome or cope with that stressful environment. You start getting into the flight, fight, fear response. Okay? The sympathetic nervous system starts getting hyperactivated. So then the heart starts beating faster and more vigorously.
10 minutes. Only 10 minutes a day. The scientific benefits of just meditation or deep breathing. Just by being in the parasympathetic nervous system, everything changes with these little powerful tools that are available.
Absolutely. Walk or exercise at a speed at which you can't talk. That is your target heart rate.
Welcome to the Lou Coutinho Show, where we can learn to reimagine our lifestyle.
Dr. Maulik, it's a pleasure to have you on Reimagine Your Lifestyle.
Thank you for inviting me.
No, thank you. We share common patients.
Yeah, a lot of them.
And your subject is so interesting. I know you're a renowned cardiologist, but the procedures that you do, and that's why we wanted to talk about that today. And overall, our audience is always looking at ways to invest in prevention, look after the heart. And if we have procedures to go through, what is the best way to come out of it? How do we look after ourselves after that? So, Doctor, I would love for you to start off with your story. Why this particular field of medicine? Take us through your journey, please.
Okay. Luke, thank you so much for inviting me, first thing. So, I don't belong to Bombay. I think most people know that by now. I'm from a city called Rajkot, which is in Gujarat. My father is a doctor there. He's an MD physician there. And a very humble background. My grandfather was a school principal.
Oh, okay.
Yeah, and always grew up watching my father do a lot of social service, a lot of treatment for the underprivileged patients, and a lot of community practice. So I grew up seeing that, and I was very good at drawing. My arts was my another forte. So I always knew that if I do something, either I'll be a doctor or I'll be an architect.
Wow.
And but yeah, I mean, my interest was always more towards medicine. So I chose MBBS as my field of interest, and I entered MBBS, and I came to Bombay for my education primarily. And I did my MBBS from Bombay. Then for my MD, which is the medicine, the post-graduation, I went to Baroda Medical College, and there I did my MD. And then again for my cardiology super specialty training, I came back to Bombay. I was with Hinduja Hospital for 3 years as a trainee, and then another 2 years as a junior consultant. And then I went abroad. I was in Budapest for 1.5 years. So there I learned all this niche interventions, and then I came back over and joined the Reliance Foundation Hospital, and we started this whole new program, the structural heart program, where we do obviously angiographies, angioplasties, but much more than that. So this is my journey, and I always felt that, basically I never knew when I started that I'll become a cardiologist. But as the medicine grew on me, I realized what are my likings, what are my dislikes, and cardiology always fascinated me. And the medical college where I did my post-graduation MD, we had our first new cath lab where we do angiographies, angioplasties, installed there when I was in my second year of residency in my medicine. And that kind of, pulled me towards the whole field and explore the possibilities. And then, one thing led to another. And that's how I'm here.
Wow. Wow. That's so interesting. And you talk about the structural program that you're running. Can you explain a little bit more about that? Because there are so many facets of cardiology.
Yes.
Yours is very, very super specialized. So I would love for you to explain to our audience.
Yeah. So basically, when I trained in India for my super specialty in Hinduja Hospital, and then elsewhere I practiced, we were doing angiographies, angioplasties. Angiography is where you see the heart arteries. Angioplasty is where you open the blockages with balloon and stents. So that was pretty commonplace by that time. I'm talking about 10 years from before now. And I had a lot of good exposure in those procedures. And then there was this new upcoming field, which was very popular in Europe and America, Western Europe and America, but not so much in India. Only a few anecdotal cases here and there. And the experts for these cases used to come from abroad and do the procedure and then go away. So I got very fascinated. Like So structural heart intervention is basically all those procedures which earlier required an open heart surgery, now being done with just a small puncture in the groin under local anesthesia, patient fully awake, and patient walks the same day and goes home in 24 to 36 hours. And the basket of procedures that the structural heart intervention offers is minimally invasive valve replacements. The heart has 4 valves, and they ensure that the blood flows in one direction and not in the reverse direction from one chamber to another. So with age, you can have a problem with the valves. So valve replacement, then you can fix holes in the heart, then you can fix a lot of other defects. Sometimes if after a heart attack, patient may develop an artificial hole in the heart or a leak in the heart. All these procedures either required an open heart surgery, or the patients were not offered anything, just left to suffer because the patients were too elderly, too sick, and an open heart was like very risky for them. So like rather not do anything. But now all these interventions form the portfolio of structural heart intervention, structural heart program. And that's what I had at Reliance Foundation Hospital. And now last 8 years, we've been running this program. And we are the largest volume center in, I would say, entire central Western India for these procedures. And one of the top 3 maybe in the country as well.
That's amazing. So you lead this program.
Yes, I lead this program.
That's amazing. And so since you spoke about hole in the heart, so this is done across ages as well.
Yeah.
So someone who's suddenly discovered a hole at the age of 60, lived with it throughout their life, and for a baby who's probably born with a hole in the heart. So you'll do it across ages. That's fantastic to know. Doctor, in the space of heart disease today, what are you seeing that is leading to more and more heart diseases as a cardiologist? What do you see? I know you see the symptom, you see what work you need to do. But when you take off your cardiology hat and you look at just the lifestyle of people today or whatever's causing all these heart problems, what comes to your mind?
So I think there are 2 aspects to that question. One, have the heart diseases become more rampant than they were earlier? I don't know. We don't have the data. But maybe yes. Why I'm saying maybe is deaths would be happening with heart disease even 10 years earlier.
But we didn't record
it. And the impact that a story has today, especially such striking stories, and the recirculation that such stories have today with social media and the multiple platforms that are available, was not there earlier. So, I mean, let's say a young guy died in a gym 15 years back or while running a marathon. A very famous doctor from Bombay died while running a marathon 12 to 15 years back. That was just a big story in a newspaper, discussed for 2 days. Then topic over. Imagine that happening today. It would be news cycles all over the platforms for 15 days, 20 days. So I think awareness and access to information and the amount of information is far more today than it was available a couple of years back. At the same time, yes, I do believe something has happened where the heart disease incidence has increased, especially in younger individuals. And in our country, I would say, if I can go a little bit off topic.
Please.
I trained in Budapest, where I used to do angiographies, angioplasties, valve replacements, Monday to Friday from 7 a.m. in the morning. The lab would start till 5:36 in the evening. There will be a list of 25 to 30 cases every single day.
Wow. Okay.
I did not see a single patient younger than 65 years of age of European origin coming in with blockages. And I was so shocked because I was already practicing in India before I went to Budapest. And I was seeing 40 years old, 45-year-olds, 35-year-olds, 38-year-olds coming in with blockages and heart attacks every time, every day. So our genetics is different. There was this one patient that came in who was 43, 44-year-old in Budapest. And he had a blockage and I was like, wow, this is the first patient I'm seeing below 60. And then my mentor told me that because he's not a original European trace, he's a gypsy. So gypsies trace their origin back to Asia.
So genetics.
Yes. So, I mean, yes, we are super exposed in terms of genetics. And that's always been there. But I think the lifestyle, the stress, sleep, lack of activity, and taking things for granted, all these things are put together have kind of caused more and more incidence of heart disease.
No, thanks for sharing that. I mean, genetics plays a huge role, but with this whole new science of epigenetics, from your experience, I mean, we've seen cases, the fittest of the fittest, if the gene upregulates, you're going to have a problem. We've also seen people with very, very poor genetics in their family, but they decide to be healthier. They decide to, and they don't get what their parents had. What is your take on epigenetics? I mean, and how can we use it to at least, because I've noticed one mentality in India, which we're trying to change, that, oh, I have type 2 diabetes because my father had it. They accept it too easily, not understanding that we've also inherited maybe the genes, but also the way of living. If my father ate 2 samosas every evening, I'm also eating it.
Correct.
I deep fried using the same oil, I'm also doing it. So do you think that epigenetics can play a role in heart disease?
Forget diabetes. People say everybody in my family is overweight.
Yeah,
People take even obesity as a
that's true.
inherited risk factor, inherited condition, you know.
Yes.
And that's where it is not right, you know.
Yeah.
Like you're like, please, you got to do something about it.
Yeah.
Okay. And this has been like told umpteen number of times. There are risk factors which you can change. There are risk factors you cannot change.
Yeah.
Now, genetics or epigenetics is a risk factor where you cannot change. You cannot change your parents.
Correct.
Yeah. As I said earlier, it's not one thing. It's a combination of multiple factors. So you may have, 2 things which are against you, but you can change the other 4 things and make the impact of those 2 things much, much smaller. You may have inherited genes and have got diabetes, and your father had history of high cholesterol, your grandfather had it, and you also have it. This is not something you can change.
Yeah.
But what you can change is you can be very careful with your diet. You can be very careful with your exercises. You can be very careful with your regular checkups and keeping your numbers under check.
Sleep, stress, controllable.
Yeah, absolutely. As of now, we are not at a stage where we can say because you have identified a gene which is responsible for particular type of problem in you, we can treat it. No, we can't treat genes yet on a large scale. But yes, we can definitely identify that yes, I am at an increased risk, and there are genetic testings where there are particular genes which make you more prone to develop cardiomyopathy, or particular genes which make you more prone to develop coronary artery disease or blockages. Knowing, you can know that, okay, I'm more super exposed and I need to be aware about other things.
Yeah. No, that makes absolute sense. So, doctor, when you look at today's generation, I don't mean Gen Zs, millennials, I meant all of us together, the generation together. What are some of the tests that we should do, like screenings at, different ages, especially since it's happening earlier? What are some of the screenings that you would advise us to do?
No age is a number that I want to give that, okay, anybody more than 25 or 35 or 45 should do regular tests. I want to say that know your risk. First, know where you stand. Okay. If you are standing in mud, you wouldn't dance. But if you're standing on the solid ground, you would be free to dance.
Nice example.
Yeah. So see where you are. Let's say I'm 35. My father has a history of heart issues. I have high cholesterol. My grandfather died of a heart attack. Or I have a history of sudden cardiac death in my family. I need to be tested now, or rather yesterday. But I have genes is family history is the most strongest piece of risk factor that you need to be worried about. Because we've seen people who are like super healthy, marathon runners. And that guy is a friend of mine, and he tells me, Maulik, you better fix me, and super athletic, slim, runs marathons, but he knew that his father had 3 angioplasties and 2 bypasses. before he died at 70. So at 36, we were doing tests since quite long. At 36 years of his age, we did an angiography. He needed 3 stents, despite all other parameters under control for many years. So genetics is the single most important factor here. That is, I think, what I believe one should do. Apart from that, the testing cycle is concerned. I would say anybody who has any of the risk factors, more than 35 years of age, a yearly or a 2-yearly heart tests. And what I mean by heart test is your complete blood profile, your CBC and all these things, your kidney and liver functions, your cholesterol, and not only the basic but the extended one, which includes the lipoproteins and ApoA and ApoBs, and your diabetes, your HbA1c. That these are the blood and urine blood tests. And as far as the heart tests are concerned, an ECG, a 2D echo, and a stress test. And if you have diabetes or a family history, maybe add calcium scoring to it.
That's an interesting point. So if you have diabetes, it's always better to look at the calcium score, right?
Because again, we can't say one thing fits everybody.
Correct,
it's about individualizing the diagnosis and approach to a given patient. So this is what I think one should do. And then based on your results, the frequency and vigorousness of further testing.
So from preventive stage, because today a lot of people are now, the whole longevity, culture that's building up. People want to, so someone just wants to look at their heart and they just want to do an, like you said, it's not a plasty, not where you're putting stents, but you just want to look at your vessels. Can you proactively do that test? Is it suggested? Because people are taking longevity to the next level of, I want to look at my heart right now. A CT angio score may not be the best, so what's your take on that?
On-demand CT angio, as I would call it. Not indicated by doctor, not prescribed by doctor, but on demand. If you have risk factors and if you're more than 35, I would not consider it as a bad test. A little bit of radiation, a little bit of dye. Doesn't do any harm in long term. Unless you're doing it every year. You can't do it.
You can't do it.
Like you can do it once in 5 years, 6 years, that's fine. I know, CT scan gives radiation, fully agreed. But the information that you get, same 35-year-old guy, we knew we had to target all this because we knew that his calcium score was very high. He already had blockages on CT scan, on CT angio, which are 50%, 60%. His stress test was always negative. A person who has diabetes, who does not have diabetes, but has a family history of heart disease, who's fit and active, but has high cholesterol. Now, if the person has CT angio, which is completely clean, no plaques also, no small lipid deposit also, then for him, my tolerance for lipids is much higher compared to a same person with CT angio showing mild plaque buildup, no blockages, but plaque buildup has already started. I would more aggressively treat those lipids. Your approach to the treatment changes. So, in a given patient, if there are risk factors which are pre-existing, I don't think CT angio is a bad test to do. It tells you where you stand. And
so
then
give you a calcium score and tell you what's happening. in your
and
heart.
then you can go from there and change your lifestyle. Because then I've seen it in many ways. It's also a motivation.
That's what I was saying. A lot of people, when they ask us, we have a lot of these biohackers who come to us, or their parents have gone through cancer and they've suddenly taken health to another level, and they're like, but Luke, what if I find something wrong? I'll be motivated to make changes. I know we should be motivated to look after our health, but it's a difficult thing anyway.
You know what I tell my patients who I want them to lose, or who I want to lose weight? I tell them to do nothing. I mean, obviously we tell them to eat healthy, exercise. I tell them, keep a diary at your bedside. Every day morning, wake up, first thing in your night suit, weigh yourself and write it down. Today's date, 24th of March, weight is 68.5. 25th of March, weight is 64.5. Same. Let it be same every day. Even this number, writing every day gives a positive reinforcement and a boost to, okay, I think I should change it. Can I do something and get 200 grams less? So it's just about knowing.
Tracking your data, basically. That's an interesting point. I like that. The only thing is a lot of people get addicted to that number. And I have some people who their day starts off badly when they see that they put on weight.
Yeah,
Everyone doesn't see it as a motivation.
I know there is always a
There's always a flip side. But I like the thing before bedtime. I kind of like that. That's
this ring
yeah.
is that can really create trouble. The numbers that you're telling me.
I'll be honest with you. Yeah. What's your take on all of these gadgets? Like, I'll be honest. I'm testing out this band only for sleep data. I sleep like a baby.
Yeah.
Okay. Touch wood. But the kind of breakup of the slow wave sleep and the REM sleep, for me, it's always, I'm very curious to know more about sleep. It's a huge factor in our practice. And so I've been looking at the data, I've been looking at rings, all of that stuff. This data is so accurate. I tested I took a 5 mg of melatonin. Okay. I don't need it usually.
Yeah.
But with a melatonin, I sleep so deeply as you would. And your sleep, your deep sleep, your slow wave sleep literally doubles.
Yeah.
Literally doubles.
Yeah.
Now, someone wears this who is completely addicted to numbers. They get stressed out. Oh, look, I've not slept well today. My REM sleep, oh no, that's why I can't remember today, because my REM sleep memory consolidation is,
that's
some
exactly
people get
the
so
problem.
anxious.
That is exactly the problem.
Yeah.
Forget the rings, with the Apple watches.
Yeah.
We get so many patients in our OPD, young guys who have no problem. They come for consult. My heart rate remains high all the time.
And the watch gives you the sinus rhythms.
Yes. They keep taking their ECGs
Yeah.
with the watch. And the anxiety of higher heart rate causes even higher
that.
heart rate.
Yeah.
And it's a cycle with which they can't get out of. So I remember at least 10 patients whom I told, please stop wearing the digital watch.
It's great for some people, and for some people who's making
there are
anxious.
patients who are elderly guys. I've told them to start wearing one.
Yeah.
Because it gives you an alarm for atrial fibrillation.
Correct. Yeah.
So, I mean, too much of anything is not so good.
Yeah.
See, lot of these devices give heart rate variability and all this. But many of those parameters have been given up by cardiologists long back, because they did not show any significance in terms of the treatment or mortality or morbidity benefit. So yes, I can give you 20 numbers, but how many of them are validated in mid-term or short-term or long-term, and have been shown to, by changing those, you can change morbidity, mortality, anything? No, then give them up. I mean, I can count many things, but is it important? I can count.
Yeah.
I can count how many steps the room is, but what's the use?
Correct. Yeah.
And I always see this, when I go to this stores and even this wearable device market, it's a huge market, and doctor will give like 20 numbers. What are the proven results of these numbers? What is the implication? Sleep, yes. Quality of sleep matters. I don't think, as you said correctly, the anxiety of something wrong with you when it is actually not.
Correct. Yeah.
Causes more problem than the problem itself.
I agree with you, because our bodies are physiologically designed to anyway adapt to one night you don't sleep, 2 nights, sudden spike in blood sugar. It's adapting all the time. But these become anxiety points. And I love what you said about the cycle. They create more cortisol and adrenaline, and the cycle just gets more and more and stuff. We see that.
It's a fear of being unwell makes you unwell. And we see this so many times.
Beautifully put.
People keep measuring their BP, blood pressure.
Yeah.
It's 135, 85. Is it high? Is it high? Is it? And then they keep measuring it every 10 minutes, and then it's even higher.
Yeah.
So, yes, numbers are good, but only when they're needed and only in the proportion they're needed.
I think this is an amazing, very, very strong point that you brought out. Doctor, what do you do for your own health? You look pretty fit. And considering your work hours.
I think we need to stop recording now.
From 8 to no, I mean, I meet people from all facets of medicine, and you've looked after yourself very well. So, what is your routine? I mean, how do you stay fit? Because you're doing procedures. Obviously, you need energy, you need cognitive health, you need balance. That comes with you looking after yourself, right?
No, so I try to eat healthy. I am not the one who goes on fasting or very restrict diets, but I try to eat healthy. I'm not telling you that I can always eat healthy. I try to eat healthy. I try to catch at least 5.5, 6 hours of sleep.
And is that enough for you? Do you feel it gets you through your day, or do you feel at some points I need more sleep?
No, I think it's okay.
It works.
And sometimes I take out some time and take a 15-minute power nap after sitting in my chair.
Yeah.
not even lying down, sitting in my chair, just in my cabin, draw the curtain, just 15 minutes of shut eye time.
Nice.
And I try to do some brisk walk and some stretch. So when I get up in the morning, I try to do some stretching, some mobility in the bed. And during the week, maybe 3 to 4 days a week, I try to do 30 to 40 minutes of brisk walk.
Nice.
That's all that I can get in. I want to do more, but I don't think time is an excuse, but it's the motivation.
At least you have to want to do it.
Yeah,
That's important.
I cannot say time is an excuse because if you want to do something, you'll always find time for that.
True.
Yeah.
And stress levels. How do you manage your stress levels? How do you manage difficult ups and downs and emotions?
Yeah, that can be challenging. I have never given advice to any of my patients, and I think this is contradictory to what most people would say, that reduce your stress. You cannot do that. Can I stop doing my job?
No.
If you are a banker, can you stop doing your
No.
job? You cannot. So to tell somebody that, reduce your stress at your work or if somebody is ill in your family, he is ill. You cannot undo
Change
it.
that, yeah.
So I think it's an oxymoron to tell somebody to reduce your stress. You can't do that. Okay. If I have some financial burden, I have it.
Yeah.
I cannot not have it by just doctor advising me against it. What I try to tell people is get small time where you're disconnected. Go away. Take small breaks. Go out with your friends. Spend some social time with family and friends. So that is what kind of recharges your brain. So you kind of negate the stress that you've been undergoing.
Yeah.
And there is enough data. There is a huge Harvard study, and I think you must be knowing about it, that people who were socially engaged or involved lived longer compared to those who were not socially very engaged or who lived alone.
Absolutely.
So getting small breaks, being with nature, being with friends and family, and basically disconnecting with what you're doing every day for a few minutes is what I try to do. It may be a very stupid movie that I watch, or it may be something that I see on my phone, or it may be a book that I try to read. But that is what I try to do when it comes to stress. De-stress for a few moments. You cannot, this is, how can you tell somebody to not take stress?
It's not possible.
How is it possible? You tell me, you are a wellness coach, you tell me, how do you?
You can't. We have to teach people to navigate through what
Correct.
they have. And we need to teach them that if you know you have a stressful day tomorrow, things like your sleep tonight can help you. What you eat can help you better. More caffeine will make you more stressed. We can only give people tools to navigate through it, but you cannot tell someone to reduce
your
stress.
That's
It's like telling them bring down cortisol and adrenaline.
Sorry, but that's the stupidest advice I can give to my patients. Reduce your stress. What am I?
Absolutely. Absolutely agree.
And our patients don't question us, but somebody someday will question. Don't tell me how do I reduce my stress.
Yeah. But I love that you brought up this point, because we've had many patients come to us saying, hey, Luke, and my doctor said change the way you eat, exercise, and also to get rid of my stress. And I'm like, how we can help you with this, but we cannot get rid of your stress, but we can give you tools. Are you willing to make a change? Are you willing? And then we give them little tools and stuff. So I'm happy that you said that up front, because then people have that extra burden.
Another thing
doctor said to reduce stress, but how do I do it? So
And again, the same cycle comes in. The stress of being in a stressful environment makes you feel sick.
Yeah.
I do angioplasties in patients, and then they come back after 2 months. Wife is worried, and the patient himself is worried because wife is telling him again and again, it's okay to be stressed at your job. I also tell my patients to go to some kind of yoga classes and adapt yoga and pranayama, because meditation and yoga do help a lot in stress management. I don't do it personally, but I tell a lot of my patients to do it.
Just to add, since you were talking about a research study, there's this beautiful study, 10 minutes, only 10 minutes a day. And you can even split it into 5 and 5. The scientific benefits of just meditation or deep breathing. And we've seen that. We've seen that in our patients before procedure, after procedure, before a chemo cycle. Just by being in the parasympathetic nervous system, everything changes with these little powerful tools that are available.
Absolutely.
So that's what we want to teach our patients, but not tell them you're stressed out. And sometimes we have to counsel families because you're absolutely right. The wife's stress or the husband's stress is creating a whole culture of stress in the family. Now everyone is stressed.
And then
Yeah.
and they're not wrong. I mean, they're worried
wrong,
that this,
yeah.
my dear one has gone through a big procedure or a
Yeah.
surgery, and now he's not able to, become stress free. What will
Mhm.
happen? Will he go back to the hospital?
Mhm.
So I think I always try to tell everybody that it's okay
Yeah.
to have stress. That's how humans work. I mean, that's how we work.
Yes. We have to accept it and navigate through it. Yeah.
We have to.
So, doctor, that's one thing. What about the impact of chronic stress on the heart? Because see, some people,
Yeah.
today we are living in a world where people want to do more. Some are ambitious. Some people have genuine issues of moving from one issue to another. Some people are stuck in toxic relationships,
Yeah.
toxic jobs, that chronic stress of always being. What are the negative side effects on the heart at a physiological level?
Heart has three things.
Mhm.
One, rhythm problems,
Mhm.
where heart rate can become fast or slow. And I'm talking purely organic cardiology. Second is when the heart muscles become weak
Mhm.
without blockages. We call it cardiomyopathy. And third is blockages.
Mhm.
Stress can lead to all three of the problems.
Mhm.
First is heart rhythm being abnormal.
Mhm.
Stress, not only emotional, but even bodily stress.
Yeah.
Stress of a surgery, stress of a losing somebody who is close to you, stress of a toxic environment,
Overtraining.
overtraining. It
Mhm.
can give rise to atrial fibrillation,
Mhm.
excessive sympathetic stimulant to the heart,
Mhm.
and it gives basically
Mhm.
irregular and fast heartbeat, which is detrimental. When we talk about heart muscle, the muscle itself, suddenly heart pumping from 55 to 60%, which is the normal pumping, goes down to 25%. We call it Takotsubo cardiomyopathy or stress cardiomyopathy. It's an actual thing.
Wow.
It's an actual thing, and it's also known as broken heart syndrome.
Oh, that's what I know the broken heart syndrome
Yeah,
part.
broken
so
heart
that's
syndrome.
the technical term.
Stress-induced cardiomyopathy and Takotsubo cardiomyopathy, all three are same. So anybody who is exposed to very, very high level of stress in terms of mental, physical, or bodily, like a 70-year-old who's admitted with a stroke or who's admitted with severe infection, even that is a type of stress on the heart.
Mhm.
Anything that has excessive stimulation of sympathetic system
Mhm.
will lead to heart suddenly becoming weak, ballooned out, and not functioning effectively, and patient goes in heart failure. So this is, and then there are no blockages. It is just the heart muscle giving up.
Okay.
If you do an angiogram, you see completely clean arteries.
Wow.
So this is when you call about muscle. And the third is blockage. Blockages can be slowly growing or suddenly coming up. All heart arteries will have some plaque deposit. Plaque is like a cholesterol bump in the lumen of the artery. Okay. So that plaque has a cap which is protecting it. So like if this is the lumen of the artery,
Mhm.
there is a small plaque which is protruding inside the lumen, which is not causing any narrowing. It is just 20% narrowing there.
Mhm.
Okay. So now it's not a blockage. It's just
Blood
a
is still
plaque.
flowing.
Blood is flowing smoothly.
Mhm.
The plaque is made up of cholesterol or the
Mhm.
LDL, the bad cholesterol, small particles LDL. Now that LDL is not exposed to blood
Mhm.
because it is protected by a cap, okay, which is the covering of the plaque.
Mhm.
This cap can rupture and expose the toxic LDL content to the bloodstream, which will propagate suddenly platelet and all the clotting factors to come and stick there, and the artery will become from 20% to 100% blocked in no time.
And it's only actually repairing itself.
Yes, and this rupture of this fibrous cap of a
Mhm.
plaque is also because of stress.
Wow.
So stress can give rise to rhythm problems, muscle problems, blockages,
Blockages.
all three.
So, doctor, I just love how you explained it. So basically, if we go into endothelial function, which
This
is our
is what
blood
it is,
vessel,
yes.
this is exactly
Yeah, we're talking about endothelium.
endothelial function. So this broken heart syndrome, okay?
I knew you would come back to that.
I want to come back to it from a different feeling.
Yeah,
See,
yeah.
broken heart, romantic relationship, no. But what when you sometimes your heart feels a particular emotion so strongly, like let's not say grief, let's say not breakup, romantic relationship. Like you're missing someone so much, you actually feel your heart kind of, it's like a painful,
it's a sinking feeling.
Sinking feeling, like a pain, or you're longing for someone, or you're whatever. It's a kind of stress then, because of your thoughts and emotions, which is creating that longing, but is the heart feeling it that way?
Not always.
Okay.
So I'll tell you what happens is, you don't feel your normal heartbeat. Yeah. Normally heart is beating, but you don't feel it. But if your BP or blood pressure is high, so when I say my blood pressure is 120/80, 120 systolic, that means heart is generating a pressure of 120 with every beat. Okay. Now, if I am in a stressful environment because of any of these things that you said, one, heart will beat faster, and two, the pressure will be much higher. Basically, the brain doesn't know what's happening. The brain is just preparing you to overcome or cope with that stressful environment. You start getting into the flight, fight, fear response. The sympathetic nervous system starts getting hyperactivated. So then the heart starts beating faster and more vigorously. And that's when you feel that kind of choking or pressure inside your heart.
I get it. So if I'm thinking about someone I'm missing, I'm relating that feeling to
So that's basically what you feel when you have overstimulation of heart. Because heart doesn't know whether you are in a fight, flight, fear, whether you have to now run, whether you have to fight somebody.
It's the brain.
Sometimes, on the road, you get into a road rage and suddenly you feel palpitations. Or before exams, you feel palpitations. This is that brain preparing heart for the next course of events. The cortisol shoots up and the heart becomes more like, like you'll be ready for everything now. Like,
wow. Thank you for explaining that, doctor.
Yeah.
So, doctor, if I had to ask you, what are your okay, before I come to that question, I was in Africa 2 years ago and I got invited by the local Maasai tribe, by the head doctor. So I spent a lot of time.
Amazing.
Yeah, because the whole idea was there was no cancer in the Maasai tribe till before COVID. After COVID, they had their first case, second, not because of COVID, because a lot of things changed, government grants changed, children started going to public schools. So food habits started changing. There's a beautiful connection of all of that. This doctor who practices, they have their own tribal medicine, had taken me through this particular meditation. Until date, I don't understand. And because of language issues, he tried to explain it, but even the translator couldn't explain it because the translator was not a doctor. I want to take a chance and ask you today. So we did this amazing meditation under moonlight where he just said, focus on your heartbeat. We did some breathing. There were some people dancing around, like a whole kind of a tribal thing. Complete silence. So now that you focus on your heartbeat, now I want you to take your attention and focus on your little finger. And you will feel a heartbeat in your little finger. Okay, I moved my attention and there was like a throbbing in my little finger, like a little heartbeat. He said, now go to your large toe. I felt the same sensation and I could feel it everywhere. Till date, I've not figured out what it could be or what it was. And even sometimes when I practice meditation, I just do that same thing. Once I focus on my heartbeat, I've got the rhythm, I know what I move it to a per body part and I can feel the beat at that same kind of a pulse, beat in different parts of my body. So I tried even in the forearm, not just the extremities because of our pulse endings. What would you say about this?
I don't know exactly what you're talking about, but I can tell you something.
Yeah.
Meditation makes you aware. So heart is, you can feel your pulse everywhere. Okay? If you put your finger here, you can feel your pulse. Just put your finger here.
Yeah, I can feel it.
You can feel it?
I can feel it.
This is called anesthetist pulse.
Okay.
When the patient is being operated on table, anesthetist who's giving anesthesia doesn't have access to this pulse or this pulse.
So it uses.
They just
got it.
This gives a lot of information about heart rate, volume of pulse, what must be the blood pressure, a lot of things. Okay. You can feel the same at the very, very distal part of, because it's all beating goes everywhere. It's just about being aware.
Wow.
That's what it is, I think.
Yeah.
Because, I mean, we feel the pulse. When the patient walks in, elderly patient, we always feel the pulse in the leg and see how the circle, that gives me an idea about how the overall, this is the distal most pulse. The moment I know that this is bounding and healthy and nice, I know the status of the cardiovascular system, that there are no, the veins and arteries are relatively healthy for that age. So these are the things. I think what you're talking about is just being aware of what's already happening.
So, okay, I get it. I get it. Thank you for that.
Yeah.
Doctor, what is your advice to our audience out there? Oh yeah, before that, I have one more question. The effects of vaping on the heart as a muscle. I mean, we have a ton of cases where we can show a direct correlation with everything. But I would love, because I think you have this beautiful gift of being able to simplify your explanations, which is so amazing. You know, vaping, I don't want to talk about smoking, tobacco, all of that. But if we specifically take what's happening in the heart when someone is vaping?
So any stimulant, so is vaping.
Yeah.
Any stimulant will ultimately give heart when you lie down, when you sleep, heart rate is 40. Your blood pressure is 90 or 100. Same person gets up, starts his work in the day, blood pressure becomes 120, heart rate is 70. Why? Because the brain and the body knows what is the current requirement. When you try to disturb this by anything, it is detrimental.
So basically, you're disturbing homeostasis.
Correct.
Okay.
And all CNS stimulants, all neurological stimulants have adverse effect on heart. Forget about blockages and all. It's just trying to change the way heart receives signals from brain in terms of what the heart needs to do right now. I may be talking to you with a heart rate of 70, and the moment I become angry, same, I'm not exercising, that rate will become 100. Why? Because now the heart knows that I may get into a fight. The brain is giving that signal. But if everything is happening as per the whole system homeostasis.
Yeah.
And when you smoke, when you take CNS stimulants, when you take any substances, you're messing basically with the signaling.
Yeah.
And that is going to have a detrimental effect. There's something called as holiday heart syndrome. Just like broken heart syndrome, there's something called as holiday heart syndrome.
What's that?
NHS in UK and in US, they observed that people were coming to the ER on early morning of the weekends, the next day morning after a Friday, like Saturday morning or Sunday morning, with abnormal heartbeats, more of chest pains and more of all these things. They realized that all this substance abuse, whether it is alcohol, caffeine, or anything, causes detrimental effect on the heart. Some long, some immediate. And the heartbeat becomes irregular, goes out of the rhythm. Patient starts feeling, sometimes it generally goes into a mode where the heart starts beating at 180, 200 beats per minute. So this is called holiday heart syndrome. So anything that messes with the signaling causes the problem.
So an overdose of caffeine, too much caffeine, that's why people feel jittery, heart rate goes up automatically.
So many times patients come to me with, my Apple Watch is showing higher heart rate, doctor, what to do. And then you ask them, they have this fancy coffee machine with the coffee beans imported directly from Ghana. And they take every 2 hours, 2 big shots. Now, I mean, come on.
I'm laughing because I got a fancy machine, but I have only one a day. But
no, but that's the solution and the problem both are with you.
So when you're doing the smoking and the coffees and the espressos together, I'm getting what you mean by this. The signaling is you're out of homeostasis for that long, basically.
Yes. Because it's designed in a particular way to function in a particular way. And you're disturbing that.
Doctor, what's the advice that you would? This has been absolutely fabulous. Thank you so much for being so generous with your information, your knowledge, your experience, and making it simple for everyone to understand. There's so much passion in the way you speak and explain. What advice would you like to leave all of our audience? Just as a cardiologist, as a human being aware of what's happening in our world today, what advice would you like to leave us with?
I would just like to say that be aware. Know what are your risk factors
Mhm.
and what you can do to change it.
Yeah.
That sums up everything.
Mhm.
We see, and I tell this many a times, just take care of 4 C's. Okay. First is check,
Check.
care,
Okay.
consult, and cure.
Cure. Mhm.
Check
Nice.
is know your status.
Mhm.
Check your lipids, check your diabetes, check your blood pressure. Because 50% of people with high blood pressure will not know that they have high blood pressure.
Mhm.
It is asymptomatic.
Mhm.
Your BP may be 170, but you have no symptoms.
Mhm.
But that doesn't mean it is not causing the detrimental effect on the kidneys, on the brain, on the eyes, everywhere,
Yeah.
on the heart. So checking, regular checkups. That is first C. Second is care. When you know that once you've checked all these things, you know that I'm exposed, care for your heart with exercise, healthy diet, and healthy habits,
Mhm.
which includes obviously good sleep.
Mhm.
And very easily doable is good sleep.
Yeah.
Some kind of activity,
Yes.
maybe just a brisk walk.
Mhm.
I'm going off topic, but brisk walk there is a talk test.
Mhm.
So they always ask me, what is my target heart rate? What my watch should tell me?
Mhm.
What my ring should tell me? I said nothing.
Mhm.
Walk or exercise at a speed at which you can't talk.
Mhm.
That is your target heart rate.
Got it.
And it will keep changing as you start getting better with your fitness.
So then you increase your intensity or your
Yes.
speed. Yeah.
So then you don't need to ask your doctor whether I'm in my 70% zone or 80% zone or 90% zone.
Mhm.
Walk at a speed at which you can't talk. That is called talk test.
Mhm.
So that is the care that you take. Exercise, diet, sleep,
Mhm.
and avoiding all the substances like smoking and all of this. Third is consult. We see so many patients doing or people doing, and I'm sure you also get them, bunch of reports,
Mhm.
like full 20 pages of battery of tests, but no action on that.
Yeah.
Okay. They do it every year, every 6 months,
Mhm.
but no action. So consult a doctor
Yes.
with the reports. You've done the reports, so consult somebody and
Mhm.
find out what you need to do. Just because your father had high cholesterol
Mhm.
doesn't mean you need to have high cholesterol, and doesn't mean it is not harmful.
Correct.
So that is consult.
Mhm.
And last is cure.
Mhm.
So much resistance I find in young people when I tell them that you have to take a statin for cholesterol,
Mhm.
or when you take a medicine for your blood pressure.
Mhm.
Doctor, once I started, I have to take it for life,
Mhm.
so I don't want to take it.
Mhm.
Obviously, there are ways when you can completely stop blood pressure and cholesterol medications.
Mhm.
If you change your diet,
Yeah.
change your sleep, change your eating habits, you can get off all these medications. But you'll have to at least start.
Yeah.
And I always tell this, start with both lifestyle modification and medicine.
And medicine together. Absolutely.
Because it may happen that at the end of 6 months, because I always see, doctor, can I try for 6 months and then we can see?
Mhm.
I said, no.
Yeah.
Start now. In short term, these medications are anyways low doses and not going to be causing any side effects because they're very safe. Billions take it. So last C is consult. So these 4 C's, if you do, you can probably keep the heart disease at least away. And if not away, pick up in time and treat. So that's, I think, what I'd like to tell everybody about the 4 C's.
Dr. Maulik, thank you. This has been just beyond amazing.
Thank you very
Such
much.
a beautiful, beautiful session. Thank you so much for your
Yeah.
time. I truly appreciate your knowledge and everything else. And
Sure.
I hope everyone watching this can actually move to action now. Thank you. Yeah.
Thank you very much.
Stay tuned for more. We're going to continue our journey, learning, sharing, and evolving.